Good morning, and welcome to the Illinois Department of Healthcare and Family Services three-part webinar series, Training for the End of Continuous Coverage Requirement. My name is Sergio Obregon, and I serve as a Special Assistant to the Director of HFS in the Division of Eligibility. Please allow me to introduce the two other voices you will be hearing today, my colleagues Margaret Dunn, who serves as a Medicaid Program Analyst in our Division of Eligibility, and Melisha Bansa, who also serves as a Special Assistant to the Director of HFS. Before we get started, I'd like to take a quick moment to thank my colleagues, both internally to HFS and externally, that helped put this together, and that also helped spread the word about this training. This truly demonstrates the collective efforts we are all making to keep people connected to care. We know that together, we can make great strides in overcoming many of the barriers our customers face when trying to access healthcare. We know that together, we can contribute to the HFS vision you see in front of you today. As displayed here, we know that by working together, we improve lives. So let's begin. Let's start by reviewing our goals and objectives for this three-day training. Next slide, please. Goals we have set forth and that we know we can execute by working together are as follows. Number one, equip our partners and providers with the necessary tools to help our customers. For example, provide information on the multiple customer-centered redetermination, completion, and submission opportunities. This includes opportunities for customers to report changes, such as a change of address or help with completing their redeterminations, creating space for customers to ask questions about their redetermination, or help a customer submit a request to reinstate their case in the event their coverage lapses. And last, connect ineligible customers to other coverage options that exist. Number two, assure that all of our providers and partners are sharing the same message as HFS and our sister agency, the Department of Human Services, or also known as DHS. Uniformity and consistency is key. Messages can travel far and wide, and we must make sure we are one voice reaching customers to keep them connected to care. And finally, by working on the first two goals, we will hit goal number three. Minimize the number of eligible customers who lose coverage, thus contributing to the continuity of coverage for some of our most vulnerable populations. Next slide. Here we have our agenda for the next 45 minutes. If you noticed in the title of this specific day's training, Introduction, the End of Continuous Coverage, we will be covering and glazing over the following: the end of the continuous coverage requirement, known as a CCR, important dates and timelines, marketing and communication, and we will be having a brief introduction to Manage My Case. Now, some of this may be redundant for you, and some of this may be new for some of you. But so everyone is aware, this material was put together in the spirit of uniformity and consistency. I mentioned earlier, this is key to aligning our collective efforts and collective voice to ensure we are reaching everyone and anyone that has direct connection to the Medicaid program. Next slide. Let's start with the quick background and overview of the PHE and the continuous coverage requirement. Next. The COVID-19 PHE changed many aspects of our daily lives. Through the declaration of the public health emergency, HFS was provided the authority to implement numerous flexibilities that touched nearly all aspects of our Medicaid operation and program, from caseworker application processing to policy, and to communication with our customers, everything was impacted. An area that was most significantly impacted was that of continuous coverage or continuous enrollment. The Families First Coronavirus Act offered us enhanced federal matching, enhanced funding in exchange for us meeting a maintenance of effort requirement. This requirement was known as the continuous coverage requirement. This meant that all Medicaid enrolled individuals would continuously be covered throughout the entirety of the PHE, the public health emergency. Next slide. As the public health emergency extended, so did the continuous coverage requirement. Although this be the case, most recently in the Consolidated Appropriations Act of 2023 that was signed by President Biden in December of last year, it amended the Families First Coronavirus Response Act to decouple or delink the Medicaid continuous coverage requirement from the end of the public health emergency, meaning that the public health emergency will end on May 11th. This amendment pulled that out of that end date, and as a result, now we will be ending, and it has ended on March 31st. Now, other Medicaid flexibilities remain tied to the end of the PHE, and we are working to ensure that we maintain those in place. We also know that because of this Appropriations Act, there will be a phase out of the enhanced federal match rate authorized by the Families First Coronavirus Response Act. And as you saw on the slide before, these flexibilities will remain intact, but what will be ending is the continuous coverage requirement, as I stated, on March 31st. And now that we know that the continuous coverage requirement is ending, this now means that our Medicaid operation and resuming Medicaid redeterminations will start on April 1st, 2023. On the slide before you, you have here various federal flexibilities that were submitted by HFS to CMS in efforts to prepare for the complex and significant volume of people looking for healthcare in their time of need. The flexibilities you see listed here will remain in place during the unwinding of the continuous coverage requirement and through the end of the public health emergency. Keeping people connected to care is a top priority for all of us who are watching today. As these flexibilities continue through the unwinding period, we are certain that they will contribute to help eligible customers get and stay covered. Let me run through some of these flexibilities. We incorporated the flexibility of accepting attestation at the time of application for the following: Illinois residency, insured status, resources, disability, incurred medical expenses, and incurred medical expenses to meet a spend down. By allowing this, we simplify the process for both our caseworkers and customers, thus contributing to customers successfully gaining access to healthcare during the public health emergency. The flexibility of delaying action on changes affecting eligibility until redetermination was a critical one because it allowed us to incorporate what's called an override in our integrated eligibility system, which is our system that our caseworkers use to process redeterminations and applications. This override would prevent eligibility from ending due to income, household, and/or resource changes. It allowed for eligibility to remain intact if changes were by or that were reported by the customer. This means that the state would not take an action on a case until that case was fully redetermined. The last two here, we also have the flexibility of presumptive eligibility for Magi adults. The launch of this flexibility now allowed for adults to receive care while we were working through their case to determine eligibility. very critical moment in time for people looking for healthcare. And the last flexibility listed on the list here is more frequent presumptive eligibility for children and magi adults, up to 2 times in a calendar year. This was key for customers who were rolling in and out of employment during the public health emergency. The PHE taught us many things, and one of those was to expect the unexpected. As a result of these flexibilities, many of our existing and new customers were now able to expect Medicaid to be there in their time of need. With that said, I am now going to turn it over to Margaret Dunn, who will start by taking us very important dates and timelines. Margaret, I turn it over to you.
Thank you, Sergio, and good morning, everyone. Thanks for joining us this morning. So first of all, I wanted to talk about the dates involved in our redetermination process, going month by month. I'm first going to cover 3 months here, but please know that redeterminations will be spread over a 12-month period, not just in these 3 months that are shown on the screen. So redeterminations will happen from June 1st of 2023 through May 1st of 2024. Now, for example, I'm going to use this first line for individuals whose coverage end June 30th of 2023. That's their current certification period. Those individuals can expect a redetermination packet to be mailed to them by May 1st of 2023. The redetermination due date that will be printed on the notice will be June 1st, giving customers approximately a month to complete their redetermination paperwork and submit it. We do have a little bit of a grace period here because we will not close that case until the 15th of the month. So we're giving a little bit of flex time for customers to get that in before we close the case in our integrated eligibility system. If individuals do not get the redetermination paperwork in by the 15th, their first day of lost coverage would be July 1st of 2023. However, we do have a 90-day reinstatement period. What that means for this group is that if they get that redetermination paperwork in by September 30th, we will reinstate their coverage and backdate it to the first day of lost coverage so that there actually is no gap in coverage for the individual. Going to the 2 following rows, you can see July and August. They follow the same timelines. The redetermination paperwork will be mailed out around the 1st of the month. The redetermination date will be the 1st of the month of the following month, again, giving them about a month to complete that. That closure date will happen the middle of the month, approximately the 15th. There may be a few day difference from month to month. And again, the first day of lost coverage will be the 1st of the following month. And we will always have that 90-day reinstatement period to give customers a chance to get that paperwork in. If it's not in by that 90-day reinstatement period, the customer would then have to complete a new application for coverage and go through the entire approval process. Now, to review the key dates that I just talked about, the end of the certification period, that's the last day of coverage if the customer does not return their redetermination paperwork by the due date. So it is their current certification period. That mail date is the date that we will get those redeterminations out to you, the customer. The due date printed on a notice is the date that we expect customers to submit their redetermination paperwork. That case closure date, as I said, middle of the month, and that's the date that the customer's case will close in our system if we don't receive the paperwork by that date. And the first date of lost coverage will be the following month, and the last date to return the redetermination and still get reinstated is that last date, that 90-day reinstatement period, so that the customer can have retroactive coverage back to the first day of lost coverage. Now I'm going to review the dates that will show in the notices sent out to customers. We have two forms that'll be sent out. The Form A, ex parte form. This form does not require action on the part of the customer unless information has changed. But I wanted to point out here the dates on this form. You can see at the top, August 1st of 2019, that is the day that the notice is sent out. The customer would get it within a few days. And you can see in the middle of the page, September 30th, that's the end of their current certification period. Their new certification period will start on October 1st. So for this particular group, this ex parte Form A group, their coverage will be ongoing without them having to do anything unless information has changed. But again, our key dates are first of the month for the notice, the 30th is the end of the coverage period, and then ongoing coverage would be the following month on the first of the month. Here's an example of the Form B. The Form B is something that goes out to customers where they will have to complete the information and send it back to us. And you can see in the screen on the left, we do list the end of their current period. So for this individual, the end of their current period would be June 30th of 2023. When the redetermination paperwork goes out to them, they will have to review that and correct any information that's wrong, as well as add information that might be missing. On the screen on the right, you can see that we've got that date we talked about, that June 1st of 2023, again, the first of the month, when we will expect the customer to return their redetermination paperwork by, whether it's the paper form that's going to be sent in or whether it is electronically through Manage My Case. We need to see that response by the first of the month. Okay, now I am going to turn it over to my colleague, Melisha Banza, to talk about marketing and communication.
Thank you so much, Margaret. I appreciate that. I'm just going to get right into it. So HFS has done a lot of work to develop key messaging and template communications to prepare stakeholders and customers for the end of the continuous coverage. You may recall that our Phase 1 efforts focused on the importance of reminding and assisting our Medicaid customers with getting their addresses updated. We have now expanded to include our Phase 2 communication efforts with a tagline that is very simple: ready to renew. To support our stakeholders, we have provided everyone access to our Illinois Medicaid Renewals Information Center that is completely stocked with resources to support and amplify the message of the Ready to Renew campaign for our Medicaid customers and key stakeholders. The resources in our Information Center provide a brief summary and justification behind the resumption of the Medicaid renewal process and its impact on the unwinding of the public health emergency. Within our Information Center, you will easily see resources such as the Ready to Renew messaging toolkit. For your convenience, you will find that the toolkit provides templates for email, text messages, IVRs, flyers, palm cards, and social media posts. These have been prepared for you to utilize for your own tailored outreach methods to our shared customers. So whether you are at an upcoming face-to-face community event or on the phone providing a customer with information regarding the Ready to Renew steps, or perhaps just blasting out text and email reminders to customers and key stakeholders, or scheduling posts across your organization's social media platforms, we've got something in the toolkit for all of your needs. Also, because we recognize that there are a lot of nuances to the redetermination process, we have developed and provided for you a Ready to Renew Frequently Asked Questions resource. This FAQ consists of tons of information to address your questions, to increase your awareness, and to empower you, your organization, and our customers through the process of getting ready to renew. In addition to the FAQ, we have also provided you with some other helpful tools, such as understanding the renewal process, which will serve as a resource to provide you with a quick overview of how renewals work, as well as our PHE unwinding operation plan for the end of the federal public health emergency. More to come on that. And then lastly, but just as important, our tool to report a Medicaid change of address form, the quickest way for Medicaid customers to update their addresses with us. In our Information Center, our Medicaid customers can also click on Manage My Case at aidillinois.com and utilize it to verify their address under Contact Us, find their renewal due date under Benefit Details, and most importantly, they can complete their renewal when their renewal is due. Next slide, please. We will continue to amplify our very clear message to our audiences. To our customers, our main message is simple. Verify your address, find your due date, check your mail, complete your renewal, connect for coverage. To our external stakeholders, which consists largely of managed care organizations, providers, state agencies, application agents, schools, churches, food banks, elected officials, community leaders, the message is also simple but impactful. Help Medicaid customers get ready to renew. Use our outreach materials and messaging to talk to Medicaid customers about redetermination. Next slide, please. So now that we have talked about audiences that will be receiving communication and messaging, we want to also talk about some of the text messaging communication that will be sent out in partnership with our managed care plans. As you can see here on the screen, we have provided you with an example of our NCO text messaging schedule. Here we have provided you with insight into our very detailed algorithm that is scheduled to deploy text messages to our Medicaid customers that are enrolled in managed care plans. The goal is simple. We want to do everything we can to remind our customers about their READY due date. Because we want to be as timely as possible in making sure that the Medicaid customers know that they have to renew. These text messages will be sent out at 75, 60, and 37 days prior to the READY due date of the customer. In addition to the other reminder messages that customers would receive, there will be a 25-day message sent out as well prior to the READY due date of the customer. And in addition to that, when that 25-day message is sent out, there will also be another helpful reminder feature called a renewal button that will be visible to customers in the AID Manage My Case portal. And even after that, messages will continue to be deployed to remind our customers even at 3 days if their READY has not been submitted. Other messages a customer could receive would be after their closure due to a non-response and or after closure due to ineligibility. There will of course be information provided with some next steps on what they can do regarding attaining coverage via reapplying through aid.illinois.gov or Get Covered Illinois. Next slide, please. This slide explains our state text deployment schedule from 2 weeks before a customer's READY due date down to the 3rd day of the month, past the past due notification. It's very critical to understand that this level of communication is for anyone that has opted in and has told HFS or DHS that yes, they want to receive phone calls, which is a given, but more specifically that they want to receive text messages from the state. As a stakeholder, another great role you can play is to encourage customers that have already acquired a Manage My Case account or in the process of creating Manage My Case account to opt in to receive electronic communication that include text, email, and phone calls. Thank you so much, Margaret. Back to you and Sergio.
Okay, great. So now we're going to turn it over to and have a quick introduction for Manage My Case. Margaret, I turn it over to you once again.
Thank you, Sergio and Milicia.
Absolutely.
So I will be talking about Manage My Case. It is just a brief introduction. We'll be talking about it throughout our series, but today we want to introduce you to the functionality in Manage My Case. There is quite a bit that customers can do through Manage My Case. We like to call it the 3 C's. First of all, customers need to create a login. That login process will be creating a password and user ID, linking that account, and then finally going through the ID proofing process. The second C is check. Customers can check for their renewal date in Manage My Case. They can check for notices from HFS and DHS. And they can also check for upcoming appointments, as well as being able to request a rescheduling of that appointment. Finally, the third C is change. Customers can change their address and Manage My Case. They can change their income. They can change who is in their household, either adding or taking away a household member. They can also report expenses, upload documents, and finally, the most important and one of the easiest ways for customers to submit redeterminations, also called renewals. Using Manage My Case allows customers to make fewer visits to their local office. It allows them to stay informed on the status of their benefits and also to manage their case information. There won't be any worrying about when their RED is, worrying that they missed a notice. They can always go to Manage My Case and check that information. I like to call it the My Chart of Medicaid. We also do urge all agencies that have customer contact and the resources available to assist customers in setting up Manage My Case accounts so that they can go through this process and submit their information and their renewals through Manage My Case. Here's the front screen of ABE, abe.illinois.gov. This is where customers can submit applications, but also using the green button in the middle of the page, Manage My Case, they can click into that and log into the Manage My Case functionality. Customers may already have a user ID and password if they submitted an application through ABE. If they didn't submit an application or they don't have their user ID and password, they've forgotten them, that's not a problem. They would simply click on that Manage My Case button. This screen on the bottom would come up and they would click on the blue words, create a new ABE user ID and password. They'd go through that process. And as I said, they would then link their account to the information on their case. And then finally, they would go through the identity proofing process. We do have a new and great process for identity proofing using the Secretary of State. It has definitely improved the process, and we have seen declining numbers of individuals needing to go through manual identity proofing. Once customers go through that entire process, they would go to this page, the case summary landing page for Manage My Case. This is the second C, the check, and there's a lot of great links on this page. There's the Renew Benefits link, and that appears only 30 days prior to the redetermination due date. There's a Report My Changes button, where they would then be led to a page where they could change the information they need to change. Customers can also apply for benefits, other types of benefits through Manage My Case. Finally, on the bottom part of the screen here, there is a Click Here for Details button under Summary, and that will give the customer more information about all their different types of benefits that they're receiving. This is the Report My Changes screen. So if the customer clicks on the Report My Change button on that first landing page, they would arrive on this page and they would choose what information they wanted to report and then click Next, answer additional questions, and then submit the change. I've highlighted the information about change in contact information. Right now, that's really important. We want to make sure that we have customers' correct address, emails, and phone numbers so that their redetermination paperwork reaches them. Also, the email and phone numbers are really important right now so that customers can get those alerts and notices and text messages. Also in this box, you can see that customers can also add or cancel an approved representative. Other changes listed here: change in household size or individuals, change in income, expenses and bills. Anything that's happening in your household, you can change the information through this report changes screen. That is the end of the introduction to Manage My Case. As I said, we will get into more information about that in future presentations. I'm going to turn it back to Sergio.
Fantastic. Thank you so much, Margaret, and thank you so much, Milicia, for providing such valuable information to our audience here today. And I'm going to actually turn it over to Milicia and see if there is anything that you would like to add before I close us out for this first day of training in this webinar series.
Oh, thank you so much, Sergio. Yeah, I would just like to encourage everyone to make sure you register for the upcoming trainings. Please register as early as possible to make sure that you have all the information that you need to participate through your attendance at that training. I would also encourage each of you to please feel free to go on social media. HFS is on there. We're on Twitter at twitter.com/ILDHFS. We're on Facebook /ILDHFS, and we're on LinkedIn /company/ILDHFS. We have a lot of announcements that are put there as well as important news, and we welcome you and encourage you to follow us. You'll see a lot of the upcoming opportunities that we have for future trainings, information, community events right there on our page. Equally, if you are also interested in attending some of our Medicaid advisory committee meetings as well as our subcommittee meetings, which is a very important one where we talk a lot about these topics is in our public education meeting as well. Please feel free to go on to our HFS homepage and click on our boards and commissions, scroll down to the Medicaid Advisory Committee, and you will find all the information about the public postings of our up and coming meeting. We welcome you. Thank you so much, Sergio. Back to you.
Absolutely. Thank you, Milicia, for that. Again, very helpful information there. And then, Margaret, is there anything else that you'd like to add before I close this out?
I would just like to again say to our assisters that share our common customers to please assist us in this process so that we do not see customers losing medical coverage. If you are able to assist customers in finding those renewal dates, in assisting them in setting up Manage My Case accounts, we thank you and we appreciate what you do for our shared customers.
Yes, thank you, Margaret. I think that was well put. We appreciate everything that you're doing with the one common denominator that we have: our customers, your patients, your members, your constituents, your friends, and your colleagues. And so that about does it for today. We hope that this was helpful and that it has brought more clarity to why redeterminations are starting and what you can do to help. If you have not done so, as Melisha mentioned, please register for the next 2 webinars to complete this series. These will also be posted after we're done with the webinar for your viewing at a later date. We hope everyone will tune in as we go in depth on the proactive steps you can take to help Medicaid customers stay connected to care, and also we will take an in-depth look at the forms Medicaid customers will soon be receiving. So with that said, from Alicia Banza, Margaret Dunn, myself, Sergio Obregon, and the rest of the Illinois Department of Healthcare and Family Services, we thank you for embarking on this learning opportunity with us, and we will see you again soon for our outreach and engagement webinar. Have a great rest of your day, and please don't forget, together we improve lives. Thank you and goodbye.